For every woman out there who is seeing their period, there are certain signs you expect to see whenever the period comes, isn't it? However, there are signs you do not naturally expect to see because you know what is normal for you. But if you begin to see these signs, it is time for you to immediately report to your doctor. Immediately. You don't have to waste time because this could imply that something is going wrong with your body and that could adversely affect your health if you do nothing about it. So I'll be telling you 5 of these signs which you shouldn't ignore. And these signs are things that you should know, not just for yourself, because having this knowledge can help you to also help someone beside you. You can even share this video with them because I've been around a lot of people who have experienced this sign. In fact, I would say even at that time, I didn't know there was something to be worried about because so many people around think it's normal, but it is really abnormal and should be reported to your doctor immediately. So if you want to know what these danger signs of period are, please watch till the end. Also, do not forget to give me a like as you watch and subscribe to my channel because here I share tips about fertility, women's health, and everything health. If you're seeing me for the first time, my name is Peace Chueze, a registered nurse and midwife, and I currently practice with NHS in England. If you enjoy this kind of content, please stay tuned as we get started. The number one danger sign which you must not ignore is bleeding in between periods. So what does it mean to bleed in between periods? It simply means bleeding in a time when you are not expected to bleed. Let's take, for instance, you have a 28-day cycle. If you finish seeing your period today, you're probably expecting to see it in the next few weeks. So let's say, for instance, your period started on the 1st of February, and then you're expecting to see it again on the 28th of February. And now, in between, maybe on the 10th or 7th or 8th of February, you started seeing another bleeding. That is called bleeding in between period, and it's something to be worried about because things like cervical or ovarian cancer can present in that form. So when you experience this kind of thing, don't just keep quiet and think it's normal. Also, at this point, I would like to explain to us that there is something known as spotting. That is, for some women, when they ovulate, they actually spot, and that is quite different from bleeding. So spotting is just like tiny drops of blood, very small. It just comes and it stops. It doesn't need to continue. But when we talk about bleeding in between period, that is the one that you need to put on a sanitary pad. Then it is something you must immediately report to your healthcare provider. Another thing that can also cause this bleeding in between period is conditions like polycystic ovarian syndrome, that is PCOS. Is also important to report because if it is found out that it's PCOS, adequate treatment can be given on time because if not treated, it can even result to infertility. Then other situations like STDs like gonorrhea, chlamydia, they can also lead to this. And then changing or skipping your birth control pills, even uterine fibroids or polyps. All of these can lead to bleeding in between periods. So this is why you must report if you experience bleeding in between periods. The second danger sign you mustn't ignore is when you have an abnormally long or short periods. Yes. So now what is normal? For you to have a normal period ranges between 2 to 7 days. Some people will say 3 to 7 days. So when you have a period less than 2 days, not good. But when it's more than 7 days, that's really bad. So know what is normal for you. Some women will say they have 3 to 5 days. Some will say 4 days. So just know what is normal for you. And then when you see something abnormal, you will know what to do. Let's say, for instance, your period used to be like 7 days and now it's extending to 8, 9, and even 10 days. My dear, that is not the time to keep quiet and say, let me watch. No, this is the time for you to report immediately because the more you bleed, you're losing blood. And so if this continues for a few months, it can lead to anemia. And that can lead you to even having more severe complications like shortness of breath, and you even be having palpitation. So generally, it's not something to keep quiet about. That is excessive bleeding. On the other hand, if you have abnormally short period, it is also something you have to report to your healthcare provider. However, it's important to know that there are various factors also that can lead to this abnormally long period. As I mentioned in the last point, things like fibroids can also lead to excessive bleeding. That makes you bleed for a longer period of time. So it's very important that when you experience this symptom, you go to your GP and get checked out so that whatever is causing it can be identified and treated on time. The third danger sign is severe cramps, medically known as dysmenorrhea. Yes, so many women experience cramps when they are menstruating, but in a situation whereby that pain becomes so severe, so painful that it even stops you from, carrying out your activities of daily living, then it is something that needs to be reported. Now, for many women, they will say, oh, it's been okay with me, but there could be other things that are causing it, because generally cramps are normal when it is mild and something you can bear, because it is caused by the contraction of your uterus. So your womb is contracting to help push out all of that uterine lining during your menstruation. So when it's now very severe, it's something to be reported, because it could be caused by things like pelvic inflammatory diseases, sexually transmitted diseases. It can even be caused by IUDs, that's intrauterine devices. That's is a form of contraception actually, and also by endometriosis and adenomyosis. So these are things that can lead to these severe cramps known as dysmenorrhea. And it is very important that you make sure that it's investigated, and then your doctor tells you, oh, this is what is causing it, so that you will know if it's something that really needs to be, treated. The treatment can be initiated immediately, and that's going to help to save you a lot of stress instead of going through that pain every single month. Something can be done about it, I believe, and if you report it, I believe you will get the help you need. The fourth sign, which you must never ignore, is heavy bleeding or bleeding with clots. So when we talk about heavy bleeding, it is subjective because it varies from woman to woman. So for some women, they don't bleed so much, whilst for some, they bleed, really little. So you know what is normal for you, and at this point, you feel you are bleeding more than it should. But now, for you to say you're having heavy bleeding, it is expected that you must have had a full sanitary pad within 1 hour. So if your pad gets filled up within 1 hour, or your tampon gets fully soaked within 1 hour, at this point, it is seen to be menorrhagia, heavy bleeding, and you must report it immediately, because failure to do this can lead to anemia. As I mentioned earlier, anemia can give you shortness of breath, fatigue, palpitation, and all the rest of them. And nobody can live without blood in your system. So it is very, very important that at that point, when you begin to experience it, that you report it and something can be done about it immediately. And also, when we talk about this heavy bleeding, then what can cause it? Many factors. In fact, when we talk about these problems with period, I've come to realize that almost all of them are caused by something like fibroids, endometriosis, IUDs. So in the same way too, when we talk about menorrhagia, which is heavy bleeding or bleeding with clots, I also forgot to mention that bleeding with clots is different from when you just see little clots, because it is also normal when you're seeing your period that you see little clots. It's not something to be worried about. But when you now begin to see these clots in a very bigger size and it's coming more often, and also remember you're now having your pad filled up within 1 hour, my dear, it is the time for you to act. Do not wait anymore. Report to your doctor so that something can be done about it immediately. So, as I was saying, what are the causes of this severe bleeding? So, the causes could be, one, due to the complications of pregnancy. Sometimes you could be pregnant and without knowing, you are just having a miscarriage, you're losing your baby. And that could be the reason you are bleeding more than you should. And then you keep quiet. So that means it can lead to something really disastrous. Another thing could be the IUDs you are using, intrauterine devices. It could be caused by conditions like endometriosis. It can also be caused by conditions like cancers of the uterus. So you never can tell what is causing your own situation. That is why you must report. That is my emphasis on this video. Whenever you see this, do not keep quiet. Make sure you report them. The final sign which you must not ignore is a skipped period. So skipping your period is not something you should be happy about. I know some people will be so excited that they just skipped their period. I know it can be stressful. It's stressful for every woman. But when you experience this, don't just keep quiet. So the first thing you need to do is to take a pregnancy test to rule out the possibility of a pregnancy. So if you find out that the pregnancy test is negative, it's now time for you to investigate. Report to your doctor, because a skipped period could be as a result of different factors. Another thing again that can cause skipped period, depending on your age, between the ages of maybe in your late 40s and early 50s, that is the period of perimenopause rather. So during this period, it is very normal for a woman to skip her period because she's just trying to approach menopause, a time when she will no longer see her period. So that is also another cause. But in exception of that, other things that can make you to skip your period are when you have a sudden weight gain or sudden weight loss, polycystic ovarian syndrome, when you engage in very intensive or vigorous exercise that your body is not used to. All of this can make you to skip your period. Another factor could be the use of a continuous birth control pill and extreme stress. So all of these are the contributing factors that can make you to skip your period. So these 5 danger signs should never be ignored when you experience them while seeing your period. So if you've ever experienced any of these, kindly leave the experience for us in the comment section. If you've got any questions regarding these also, kindly ask me in the comment section and I will sure give you my answers. If you've got any value at all from my video, kindly give me a like and subscribe to my channel. Remember, in this channel, we share tips about fertility, women's health, and everything health. Thank you for watching and I'll see you in my next. Bye for now.